Welcome back. Misa Manshadi joining us from Manshadi Pharmacy on this Wednesday afternoon, talking about something that a lot of people are in fact talking about, seasonal allergies. They've been brutal this year.
It has been brutal, and we see more and more people coming to the pharmacist and asking different questions how to treat their allergies.
Yes, it just seems to me that this year has been an anomaly in terms of the severity that some people are experiencing their seasonal allergies.
It may be because of we had a late spring and the summer, and we have a really warm and windy weather right now, and it seems to be definitely there is more pollen counts in our atmosphere, so that's why. But I don't think it's more than any other year.
Just a late start.
Yeah.
We have some boards that we're going to put up to talk a little bit about the causes of this seasonal allergy and then later treatment. So we're talking there, Misa, about wet late spring, which is absolutely what we've had.
Exactly. So we are talking about we had a wet late spring, and there's a windy, warmy condition out there, and there's a lot of dust and pollen flying around. There is, most of the time, we see the wind pollinated plants that are causing problems such as tree, grasses, weeds, and sometimes people also have mold and pet dander allergies. We see more of the grass pollen allergies than other weed or trees in our area.
Okay.
Yeah.
We have another, the next board we can put up as well. This is more causes.
Yeah, so remember, early spring usually is related to tree pollens. After that would be perhaps summer, and late spring is grass, and during the fall more like a weed allergies. It's very important because if you know when you have those,
you can prepare ahead.
You can prepare ahead, and you would know what you have allergy. So if you have allergy right now, you may say, okay, it's a late spring, maybe it's a grass. Yes.
And then for some poor folks, all year round, they get these allergies.
That's correct. Some people, they have they call it seasonal allergies, but it can be all year round.
Okay, so let's go to the treatments now.
Sure.
There's several options that people can
So we can Google it. Let's Google look at the pollen counts, and that is something that would be good to see. Always, the avoidance is the best thing to do. If it is possible, we should avoid it. Close the windows if the pollen counts is high. Important to keep your bedroom clean. Wash the bedding is important. Some people, it's good for them to shower twice a day. If they especially if they shower in the morning, just before they go to bed, they shower again to wash out the pollen. And you want to start the treatment early. So if you're going to take antihistamine, maybe start a little bit earlier so you don't even suffer it. You just go right through it. So those are some of the options that you can do. There are alternative treatments as well available, which you may it may or may not work, such as some people take pollen, Kamloops bee pollen, or Kamloops honey. Some people, they take probiotics such as acidophilus and flavonoids, which comes from the fruits and vegetables. They may or may not also help for people's allergies.
Okay. Is that almost acting like a natural antibody that you're putting into and it's getting your system to fight or sort of build up immunity? Is that what it is?
Exactly. So these allergens, causes our immune system to function differently. So that's why we get those symptoms. So sometimes if you give those allergy to the patient, they will start to prepare antibodies. So later on, when they have those allergens come to them, they don't have a severe reaction. So that is the reason behind it.
Okay. I believe we are out of time. There's a lot of information to take in there. Some of those boards were pretty busy. But thank you for the information. And thank you for being here today.
Thank you for having me, Susan.
Absolutely. But if you do suffer from allergies and you would like to maybe try and figure out a little bit more about what your causes are so that you can treat yourself more succinctly, you can certainly head down to Manshadi Pharmacy. There is a South Shore location and a North Shore location. Information is on the screen there. We are back after a quick break. Stay with us.